Hi, everyone. Welcome back to Neurospicy Nursing. And if you're new here, welcome. This is your ADHD friendly study buddy to help you turn nursing chaos into clarity. Today, we're just going to be doing one of those rationale exams, going over them, talking a little bit about them. The content on these questions is going to be based on oxygenation, as well as sleep, infection control, and the surgical client. So we've got a lot of topics to go through on these 30 questions. If you're one of my students, there's a good chance you've already received this quiz. If not, I do give you guys time to go over the question, while I'm um during this video. Um, but just before we get started, go ahead and answer this first question if you haven't already. All right, for this first question, the correct answer is going to be B, encourage the client to verbalize their concerns. We really want to make sure that we're listening to our client. This is that therapeutic communication, and you're allowing them to express their fears. It's going to help reduce that anxiety, and it's going to also allow that building of trust with our patients. Even though, they always like to say, give statistics and stuff like that. Um, that can provide false reassurance to family, and to the patient, and it's not really a therapeutic way of communicating. All right, so pause if you haven't answered. The correct answer to this one is going to be C, notify the surgeon immediately. So consent is something that has to be taken before we do any sort of procedure and before any sort of sedation has been administered. Sedated clients cannot legally consent because think of it like their brain has been impacted. They may not really be able to understand what they're consenting to at this time. So they have to have it done before they get any sort of sedation. All right, for this question, the correct answer is going to be A. We're going to document that CPAP use and we're going to notify the anesthesia team. If you guys haven't watched my surgical client and oxygenation video, I definitely recommend going through that, and it will explain a little bit more about obstructive sleep apnea, and kind of the risks within surgery. But having obstructive sleep apnea is going to increase the risk for anesthesia. So the anesthesia team, your CRNA, your anesthesiologist, they really need to be able to plan this individual's airway management. So the correct answer to this question is going to be ablative. A mastectomy is removing tissue. So when we're removing any sort of tissue, that means that it is an ablative surgery. And in this case, they're removing it for the cure. So it technically could also be um, palliative if you want to consider it that. I would have accepted that answer, but really for this question, I'm looking for ablative, which is B. All right, the correct answer to this one is going to be A, padding the bony prominences. And the reason why is because when we think of skin breakdown, we're thinking that, a lot of it's going to happen on those bony prominences. We can see them on the shoulders, the elbows, the knees. So by padding them, it's going to prevent any skin injuries as well as nerve injuries during those different positionings. So the correct answer to this one is going to be B, use latex-free supplies. So if someone has an allergy to bananas and kiwi, they are going to have a cross reaction with latex. So you have to make sure that you provide a latex-free environment for this individual to prevent any sort of anaphylaxis. Alrighty, the correct answer to this one is going to be B, stop the anes anesthetic agent. Sorry. Stop the anesthetic agent. So, malignant hyperthermia, remember it is a super duper duper intense, very, very high fever that certain groups of individuals get when they get anesthesia. Um, for those of you who know me in real life, we live in North Carolina, so there is a tribe of Native Americans that are called Lumbee. They are at super high risk for that malignant hyperthermia. So, whenever we start seeing some of those side effects of the malignant hyperthermia, we have to stop giving them their anesthesia because that's the trigger. And then, as soon as we stop the trigger, we're going to give them dantrolene to reverse the effects of the anesthesia. But stop it first and then administer. So the correct answer for this one is going to be B. We're going to reposition the head and the jaw. So that snoring sound is indicative of some sort of airway obstruction, and airway obstructions can really be very common postoperatively. Think about the anesthesia that you just had. You're very drowsy. It's relaxing all your muscles. So by repositioning that person's head and their jaw, you're restoring that patency to that individual's airway to allow for better oxygenation. So the correct answer to this one is going to be B, provide adequate pain relief per orders. Remember, the pain is whatever the patient says it is. It doesn't matter if they're giggling and laughing and they say their pain is a 9 out of 10. We're going to chart it as a 9 out of 10 and we're going to treat it like a 9 out of 10 because everybody reacts to pain a little bit differently. So make sure that even if they do have a history of substance use, that we're still, if they say they have 9 out of 10, they have 9 out of 10 pain. Substance use is not an excuse to not properly medicate someone. Under treatment is unsafe for individuals. We have to make sure that we're treating their pain responsibly. So the correct answer for this one is going to be A. I will wash my incision with soap and water daily. So gentle cleansing is going to help promote healing. Steri strips, they're something that fall off naturally. As you can see, it says B, I'll remove the steri strips tomorrow. So we're not going to force them off. We're going to let them remove naturally. And then it talks about lotion. Don't put lotion on your incisions and don't tell your patients to put lotions on their incisions. The only time we have an incision and we're putting quote unquote lotion is for a circumcision. And it's not even lotion. We're putting Vaseline on it and we're like slapping a ton of Vaseline on that. That's the only time where you're going to see some sort of like moisturizing happening on an incision site that I can recall. Maybe I'm wrong, but from what I can recall, that's really the only time we're really putting lotion on an incision site. All right, the correct answer to this one is going to be A, NREM stage one. So, stage one, it's our lightest sleep. It's that in between phase of being asleep and being awake. So, it's very, very easily like to wake up from this stage and all the sounds and stuff like that to wake you up. Um, but occasionally, um, since your brain is still, has gone through the beginning stages of getting rest, some people can wake up out of this stage and feel rested, even if they were just in stage one the entire time. So the correct answer to this one is going to be B, stage two. So sleep spindles are occurring in this stage. Um, and because of the sleep spindles, that's where we see that really, really critical piece of memory consolidation. Um, so that's what makes this stage two. All right, for this one, the correct answer is going to be C, stage three. Deep sleep is associated with those delta waves, and it's super important for that physical restoration. Younger kids will see them go through stage three more often because they're growing. They need that healing properties of the stage three. And the super deep sleep is what that does. So the correct answer for this one is going to be C. All right. So the correct answer for this one is B. REM resembles wakefulness on an EEG. So when we talk about REM sleep, we can see an increase in heart rate, BP, respirations, all of that because of the rapid, just that's how the rapid eye movement phase works. And that's why on an EEG, it might resemble wakefulness. Because once you start getting into stage two, you see the decrease in the temperature, the decrease in the heart rate, the decrease in the BP, and that's normal. But for REM, I'm so sorry, guys. For REM, we see the wakefulness because of the increase in blood pressure and heart rate. Um, it also shows high brain activity because it's not light sleep, and that's why it resembles wakefulness. So the correct answer to this one is going to be B, alcohol before bedtime. Alcohol does disrupt your sleep cycles and can contribute to insomnia. A lot of people think alcohol is a depressant, it's going to help me go to sleep. Well, actually, it contributes to insomnia. So people who self-medicate with alcohol to try to sleep, but still complain of sleep issues, there's a good chance it's because they're having alcohol right before bed. All right, this one is going to be again before bed. So I talked about it being a CNS depressant. With it being a CNS depressant, it's going to relax those airway muscles. So, with the relaxation of the airway muscles, it's going to worsen that obstructive sleep apnea and cause more of that snoring sound because of that relaxing of the airway. A lot of times in obstructive sleep apnea, since their airway is fully relaxed, their tongue almost falls into the way, and that's what's causing the snoring sound. Um, which is why CPAPs or BiPAPs are really important for these individuals to keep their airways open. All right, the correct answer for this one is going to be bleeding. So repetitive swallowing in a post-tonsillectomy patient is indicative of bleeding. And I don't just mean like swallowing like once or twice. I mean like excessive swallowing. Like they seem like they're swallowing a lot or like hypersalivating. That's a sign of bleeding. I also want to let you guys know that, and I've discussed it with some of you guys before, that tonsillectomies for little kids or adenoidectomies, even though they're becoming a little bit less common, they are going to be less high risk the younger the patient is, one. And two, a lot of times we have a tonsillectomy because a child, I mean, think about their airways. They're very small. So if we're having tonsils that are blocking off a certain percentage of their airway, it's going to cause snoring sounds or OSA type symptoms. So by removing the tonsils, by removing the adenoids, it helps improve oxygenation in children while they're sleeping. All right, the correct answer to this one is going to be B, cataplexy. Cataplexy is the sudden loss of muscle tone that's triggered by emotion. So cataplexy is commonly seen in narcolepsy type 1, and it's technically based on hormones. I'm not going to have you guys know everything about those hormones, and I don't think for the purposes of your exam you're going to need to know them either, but do know that cataplexy is with narcolepsy type 1 and narcolepsy type 2 is you still have narcolepsy, but without the presence of cataplexy. All right, so the correct answer to this question is going to be redirecting gently back into bed. If a child is sleepwalking, we are not going to wake them up. we need to do it in a safe, non-confrontational manner. So by redirecting them back into bed, making sure they're like tucked in and, we're not waking them up, we're not startling them. That's really the best way to manage parasomnia, which is sleepwalking is a type of parasomnia, by the way. Which I also do have a video that discusses the difference between narcolepsy and parasomnia. Again, if you guys have not watched it, I definitely recommend it. It goes a lot more in depth, and you don't have to worry about the AI voiceover stumbling over their words like I do. All right, so the correct answer to this one is going to be the non-rebreather mask. Non-rebreathers, they deliver anywhere between 60 and 90% FiO2, which is the concentration of O2 that an individual is taking in. But do know, because of the mask, FiO2 is also based on how an individual is breathing. So keep that in mind of why the range is 60 to 90, because it's also about how that individual is breathing or the way that they take in the O2. All right, the correct answer to this one is going to be B, inflate the reservoir bag. It seems really silly, right? Like, inflate the reservoir bag. You guys will probably see a question like this on your test, but it is so important. And, even in simulation, right? Like, we're in a rush, our patient could be seizing, and we're just trying to slap that O2 on them to make sure that they're perfusing because airway, breathing, circulation, right? But in order to prevent them from suffocating, you have to make sure that you're inflating that bag to ensure that that individual is getting the oxygen that they need. Because if not, they're going to still desat with that mask on their face. All right, the correct answer to this one is going to be B, maintain ordered target range. So obviously, COPD patients normally their SpO2 stat or just O2 stats in general are going to be a lot lower. And they can tolerate lower SpO2s because of their condition. The one thing that you do have to worry about though is high O2 and high CO2 retention. I have a video on COPD that talks about how these individuals get um, oxygen toxicity as well as CO2 toxicity because of the obstructions in their airways. So make sure you go watch that. All right, the correct answer to this one is going to be C. Avoid cotton sheets due to static. They generate static electricity. If you have an O2 tank, that's not safe. Also, I would also take the use of petroleum jelly for nasal dryness because petroleum jelly is flammable. And even though people are commonly using it for their nasal dryness, it's technically contraindicated for O2 use. Really, the best thing is going to be either um, humidifying that oxygen, or if they absolutely need to put something in their nose, using some sort of water-based lubricant to help with that nasal dryness. But humidifying oxygen is the best way to prevent any sort of mucosal dryness. So the correct answer to this one is going to be B, a needle puncture. So that's considered the portal of entry. So when we're thinking of, the chain of infection and all of that, and how to break that chain, the portal of entry is how it gets into another individual, right? So in this case, they had a needle stick, and that direct inoculation is what can cause the nurse to get hepatitis, and that's why they'll go and get screened after a needle stick and run through all the tests. But you guys don't need to know those specifics for your test. All right, the correct answer to this one is B, prodromal. Um, those early symptoms of any infection, like a fever, malaise, those are indicative of that prodromal stage. All right, the correct answer to this one is B, symptoms lessen. In our decline stage, our immune system is starting to fight off that infection. Our white blood cell counts might be a little bit still on the higher end, but we should be decreasing symptoms at this point since our immune system is working properly. All right, the correct answer to this one is B, rest, nutrition, and gradual activity. So this is the full-blown recovery stage, the convalescent stage. So by focusing on recovery and building strength, it's going to help you get over that last little hump to fully get over that illness. The other thing too with nutrition, hydration, make sure that they are drinking fluids. It's something that's commonly forgotten about when we're sick. You know, we don't want to eat, we don't want to drink, but fluids, hydration, super important. So even little things like tea or chicken broth, super important for helping getting over that last little hump. So I kind of touched on this earlier about that Hep B exposure and like things that we're doing. But immunoglobulins, what they do is help prevent severe infections. So the correct answer to this one is B. Immunoglobulins provide passive immunity. And by having that passive immunity, it's going to reduce the severity after a Hep B exposure. So they're more likely to end up, because Hep B can be chronic or acute, with some sort of acute Hep B, even if they even get it. They may not get it. All right, the correct answer to this one is going to be hand hygiene. Hand hygiene is so important for everything, everything. So make sure that you do your hand hygiene when you come into the room, when you leave the room. If you know that you have a C. diff patient, wash your hands with soap and water. It's the best way to stop a pathogen from spreading. I also like to tell people if you're using a stethoscope and you have a patient that's on airborne precautions and they don't have like their own stethoscope or some sort of contact precaution, and you're still using your stethoscope and then going around, please, 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 please wipe your stethoscope down with an alcohol wipe, a purple wipe, a bleach wipe if you have to. However, just wipe it down and clean it before you go on to the next person, because that bacteria or whatever is going to be on your stethoscope, and now you just put it onto your other patient. So make sure that you clean your stethoscopes as well. All right, the correct answer to this one is going to be an immunocompromised adult. So this is kind of going back to that cleaning your stethoscope, right? They have weakened immune systems, so they're really, really, really highly susceptible to infections. So if we're doing those simple things like washing our hands when we come in and out of patient rooms, even if we're just in there for 2 seconds, and wiping down our equipment that we use on all of our other patients, that's also going to help protect those individuals who are immunocompromised. Some of them, if they're super duper immunocompromised, they might have to be on like neutropenia precautions, which means that you'll have to wear a mask and stuff like that and be very careful when you're around them. That way you're not getting them sick. I always counsel people just wear a mask in anyone's room, especially if you don't know. It's okay to go into someone's room with a mask on. But that's all 30 questions, and that's all I have for you guys today. If you need any help, feel free to reach out, but also watch those videos that I mentioned in this rationale video, and I think you guys will be good for your tests. Thanks for watching. Please don't forget to like, share, and subscribe. Bye bye.